what we discussed, that the speaking is going to start with the speaking today. We have like 15 to 20 minutes for speaking. The first is the ID check. They can check your ID document and they will, like take your registration for speaking. Followed by the warm-up session. In the warm-up session, they can ask us a general question about your name, profession, hobbies, why OET, and so on. Then we have the role play cards. Or role play card. What are the role play cards? These are profession specific. First of all, these are profession specific. So we have the profession specific role play cards. So first of all, they are going to give you 2 to 3 minutes time to read, to understand, and if you do have any question regarding the speaking subtest or the cue card, you can ask this time, right? Okay.
सर
So
एक रोल कार्ड प्ले
first of all, for each card, they are going to give you 2 to 3 minutes time for preparation, and then we have 5 to 6 minute time for counseling. Okay. Remember one thing, that the person who is conducting this role play card is not your examiner. He's just interrogator. He or she cannot comment on anything on your performance, or even if they comment, we cannot take their comment as like as a judgment, or as like a person who can examine you or who can give you the marks, because they are not trained for that. So they are just the fluent speaker and actor, right? Anyhow, basically, in this 5 to 6 minutes time of counseling, you should remain patient focused. In 2 to 3 minutes of preparation time, you can ask any question if you want to ask. What would be the card look like? You can make the notes, you can look the card during the time. The first of all, the first thing is the setting, right? Then we have the history part, and these are the tasks that has to be achieved. So what we have in the setting part, like maybe clinic, maybe emergency department, right? Maybe suburban clinic, and so on. This is the setting part. Maybe ICU ward, like as well. Afterward, we have the history part. Now, history part, this is the information the doctor already know. A lot of information that doctor already know. So you can use the history to drive the question, open and close, anyhow. Followed by the task that has to be achieved, right? So total marks for speaking are like we have 500 marks, and qualifying score is 350, right? So now we can see the areas that they are going to test in your speaking. The first area is the clinical skills. In terms of clinical skills, they can ask you a few things. Like you have to demonstrate few things. Sorry, your PR skills, personal relationship building skills. It means that you should have appropriate greeting, right? It means that you should have an appropriate greeting, right? Your tone should be appropriate as per the card, okay? And similarly for your language. If you are inviting someone for the counseling, depending upon the situation, it's an emergency situation or if it's a normal situation, accordingly you have to adjust your tone. So the first thing is the PR skills. We have greeting, We have patient response to the condition according to the patient response according to the situation. You have to move on. However, the normal thing is to go with the open and close-ended question. We have open and close-ended question. So, what is the open question? Open question we can use, let's say simply, how can I help you? Is open-ended question. Let's say, what bring you over here? Or we can just use, I have gone through your file and I came to know that, let's say, I have gone through your file and I came to know that you have, let's say, blah blah problem. But if you can tell me in your own words. So all these questions are open-ended question. How can I help you is also an open-ended question. What bring you over here is also an open-ended question. Or I just have gone through your files and I came to know that you have headache. It's also an open-ended question, right? Okay. So you can see there, after open-ended question, you would have an idea the nature of the patient. If the patient is talkative and he had given me the landing complaint, so after listening to the complaint, empathize the patient. Empathy should not be a memorized line, but you can derive the empathetic statement from the card. Like, oh, Mr. Mark, it's totally understandable that you are having this pain, like that. You have to empathize the situation accordingly. After empathy, we go for the close-ended question. Now, what are the close-ended questions? Where we can expect the answer in yes or no. Let's say, do you have this pain at the moment? Or when was the first time you had this pain? Let's say, or did you take your medicine on time? Yes or no type of answers. So open followed by the close-ended question, right? We have to ask in the speaking part. Afterward, like in you have started with the greeting, you have started with the settle the patient down. We can say that in the PR skills, we have to greet the patient. We have to show the rapport building skills, like offer him glass of water or have some chit chat with the patient. Then open-ended question. As per the patient response, if it's talkative, we can go for empathetic statement. If it's not talkative, so you have to be talkative enough so that you can provide him some empathetic statement and help the patient to be comfortable with you. After open-ended question, we have closed-ended question. Now, this is a question. You can have the answer in yes or no, or the collection of question with the appropriate range of grammar. Let's say if it's the pain related, we can start with the how long you have been having this pain. Did you take any painkiller? Is it on one side or maybe is it radiating? Let's say like that. So we have to use the range of grammatical structures to show our range of grammar and do ask the collection of question. After this collection of question, the closed-ended question, if your card allows you, you should go for examination. Not in real, just by asking some statements. You need to ask the patient, for example, please open your mouth and say ah. In case of oral examination, then if it's a physical examination, you can ask the patient, please lie down on the couch or maybe take off your shirt. I'm going to press your, let's say, shoulder. I'm going to press your tummy, like that. You have to use the open and closed-ended question followed by the examination. Now, after the examination part, before we can move on toward the education, we have the transition or patient perspective part. What we have in the patient perspective, let's say explore the patient concern, if there is any. Before we can start him educating the patient, this is important part. Sorry. Explore the patient concern. Then we can see explore the patient expectation, if there is any. Before telling him what is the diagnosis, you can ask the patient, what do you think, what it could be, right? And how it can be treated, let's say. Whatever the circumstances are, accordingly, we can modify these statements and explore the patient knowledge. So, this is something that we have to see in the speaking part. First of all, what we were having in the speaking, if you recall. So, first was the PR skills. In the PR skills, we have, let's say, greeting, we have rapport, we have empathy, and patient oriented, non judgmental speaking. The inventor means that you have to listen to the patient and with empathy. So, these are the skills that you must have in the personal relationship building skills, and you have to show in the card time and again. The next part was information gathering skills. Information gathering skills. That is the next part that you must have. And what we had discussed over here in the this part, we have open question, the question that can push the patient to speak at length. For example, how can I help you? Is an open-ended question. What bring you over here is an open-ended question, or we can say that, uh, like I can see from your file that you had no problem, is an open-ended question. Followed by the closed-ended question. Now, as closed-ended question, you can use these statements such as uh, how long you have been having this pain, for example. Did you take any painkiller? Is it the first time, or do you have any history? Mostly in the present tense, but at time we can use the past tense and past continuous tense as per the question. After closed-ended question is your card allows you to go for the examination. Okay. And then we have patient perspective, like where patient is standing. After you have gathered the information, we can move on toward the education skills or the providing skills. So what you have in the providing skills, maybe first you have to explore the patient knowledge as we discussed in the last part, followed by we can say that explaining in non-technical language, like abbreviations are not appreciated. Explain in non-technical language, right? Natural pauses should be used. Cohesive devices and sign posters. So these are some of the things that you have to use when you are providing the information. Explore the patient knowledge was in the transition, like you have to ask the patient, what do you think? What it could be? That is called explore the patient knowledge of that card or the scenario or the diagnosis, right? When we are explaining the card, let's say for vomiting, in term of non-technical language, we can use the throwing up. For the descending colon, we can use the large part of lower intestine, maybe. And let's say for palpitation, we use palpitation, but we use the heart racing for that. So we have to explain in the non-technical language and as simple language as you can to make sure that patient should be understanding and you would be able to comprehend what you're saying. Afterward, we must have the natural pauses. So natural pauses are quite important. Why they are important? They are important, first of all, to understand about the fact that when we are exploring something, when we are explaining something, there must be transition between the tasks. Like if I have explained you about anything, so you have to take a pause before you can move on to the next thing in between the task even. Cohesive devices are firstly, secondly, thirdly, moreover, furthermore. Where it's appropriate, use them. And the sign poster is the major transition between the tasks. Like we have, let's say, two areas, let's say diagnosis and treatment. We have to signpost this thing. For example, I have explained you about the, let's say, diabetes mellitus. If you would like to ask any question regarding diabetes mellitus, please feel free to ask me. Okay. If you don't have any question, I'd like to move on to the treatment plan. Can I? So basically, this is your signposting. Like you have clear transition between the task, right? Basically, signposters, as the name indicates, like these are the transitional devices. For signposters are the is the terminology that has been extracted from, you can say, from your daily driving things. When you are driving, you can see some sign marks, like you are driving on the highway and there is a sign marks of maybe a bridge or maybe diversion. So we reduce the speed so that it's indication for a driver that now the highway is going to be finished into a roundabout, so please reduce your speed. Similarly, when you are explaining or you are telling this something to the patient, you must make sure that there must be a clear transition between the tasks. Let's say if we have explained the diagnosis to the patient, so what are the three steps? Ask for clarity. Like, have I made myself clear? Or Mr. Mark, do you have any other question? Ask for clarity. So in signposting, first of all, we can go for the clarity thing. Have I made myself clear? Rather than are you getting me or are you following me? We can use the things like that. Have I made myself clear? Is there anything else that you want to discuss? Right? Okay. And then lead it. If you don't have any question, I'd like to move on toward the treatment plan. So this was the signpost. First, ask for the clarity, right? Then lead the scenario by the help of the signposter that you have finished the diagnosis, now you are moving on toward the treatment. Similarly, after treatment plan, you can ask the patient, okay, Mr. Mark, I have listed down the treatment and discussed with you. If there is any allergies or any problem that you might be facing with the this medicine, or if you have disagreement with this treatment plan, please feel free to tell me your point of view so that we can discuss. Okay, if you don't have any question concern, I'd like to move on and discuss the preventive measures. Can I? So these are the signposts. Okay. Most important things, while information gathering, some things, do not go for compounding. Do not go for compound question. Compound question means try to ask one question at a time, not go for 2 to 3 questions at a time. Right? Never ever interrupt the patient. Never ever raise your tone against patient. Right? First of all, make sure that you should go for compound question. Never go for compound question. Never ever interrupt the patient. Never raise your tone against the patient. So these are some of the clinical areas that we discussed with you. If you like to ask any question with reference to the speaking part, please feel free to ask me. Now you can see this. This is an example as for our card. We can see this is the setting part. Maybe suburban clinic. This is the history that you already know, and these are the tasks. Now you can read the card let's say you are speaking to a son or daughter of your 68-year-old patient, Harry Smith, who has a history of AF and who takes warfarin to reduce the risk of thrombosis and whatever. Now, this is the presenting complaint right now. The patient is here for the Panadol food because the patient had a fall and there is extensive bruising. Sorry, the carer is here because his father had a fall 2 days back and there is extensive bruising in his right thigh, but there is nothing else. Now, you have to refuse the patient. We should not refuse directly. How can we start the card? We can start the card in this way. Hello, my name is, let's say, Dr. XYZ. I'm one of the doctor in this clinic. So let's say if you can ask the name, can I confirm your name and age, please? Or you can confirm the name before you can start the card. Let's say if the name of the patient would be Mr. Ellison Morgan. So we can just write it down. Hello, Mr. Morgan, please have a seat. Would you like to have a glass of water or cup of coffee? Okay, so I've just have gone through your file and I came to your father file. If I'm not sorry, or we can just start like that. Sorry, I made it wrong. Hello, my name is, let's say, Dr. XYZ. I'm one of the doctor over here. So, for your confirmation purposes, can I confirm your name and age, please? Okay. I'll just go on the file of your father. I think you must be son of Harry Smith, right? Okay. So I've seen his file. I can came to know that he had a fall, which I can understand that it must be distressful for you and for him as well. So can you tell me in your own words, like how he had fallen? Started with the card greeting, followed by the open-ended question. Then the patient will tell you something like, yeah, he had a fall and blah and blah. Provide empathy. Oh, Mark, it's understandable that it must be distressful for you that he cannot walk properly and there is pain. So, Mark, like, what have you consulted any doctor? Okay, and did they prescribe any medication? Fine. So, what you're saying that you need a Panadol 4 because you just have self-prescribed this medicine and you want me to prescribe this medicine, okay? So is it possible for you, Mark, this you can bring your father in here because I'm afraid I need to see your father first before I can write any prescription. This is also a refusal, not directly, but indirectly, right? Afterward, patient will be a little bit fussy with you that he can ask you why you are not writing this painkiller and so on. You can assure the patient, Mr. Mark, first of all, let me assure you that Harry's well-being is the topmost concern for me, right? So, as you can see, as I can see from the file, that Harry has been taking, you can say, warfarin. And do you have any idea that how warfarin may interact, you can say, with the medicine that you are asking? I'm afraid that if the medicine that you're asking, if we can prescribe to the Harry, it would affect the Harry's well-being. And ultimately, the health of Harry would be compromised. So, for that reason, we want to see Harry first before writing any prescription. I hope I'm making my ground up. Or if you have any question, then patient can ask you like, in this case, like what should be done. Then you can ask the patient like, I can pay a home visit. Just to show you. So what do you think? He will be bit of concerns, and you have to show. Don't worry. After Harry's consent, he can pay a home visit, right?